everyone, welcome back to my channel. So Svnirtar MPT एंट्रेंस 2023 का इससे पहले वाले क्वेश्चंस को मैंने पार्ट 1 में कवर किया है एंड उसमें जो भी मिस्टेक्स हैं या कुछ आंसर्स का रॉन्ग हैं सो वो आप कमेंट्स में देख सकते हैं। सो उस तरह से आप अपने क्वेश्चंस को देख सकते हैं कि कितने आपने 48 क्वेश्चंस तक ठीक किए हैं एंड 100 क्वेश्चन आज हम कवर करेंगे फ्रॉम 49 क्वेश्चन नंबर। सो लेट्स गेट स्टार्टेड। सो ट्रैक्शन फॉर अपर सर्वाइकल स्पाइन इज गिवन with head in. So correct answer is, so options are minimal flexion, neutral, mild flexion and mild hyperextension. So the correct answer is D, mild hyperextension. Question number 50. Alveolar bullae are seen in, options are bronchiectasis, bronchitis, emphysema and bronchial asthma. So correct answer is emphysema. Question number 51. Reflex not present at birth is, so options are Moro reflex, symmetrical tonic neck reflex, crossed extension reflex and asymmetric tonic neck reflex. So correct answer is symmetrical tonic neck reflex. Question number 52. A 35-year-old patient with a complete T5 spinal cord injury is working on a supine to sit transverse on the mat table when he suddenly appears flushed and complains of his heart pounding. Upon examination, his blood pressure is 180/100 and he has a pounding headache. The most appropriate initial course of action is, so options are lay the patient supine and notify the physician, B, sit the patient up and notify the physician, C, allow the patient to rest longer between sets of activity, or D, initiate core strengthening exercises to maintain intra-abdominal pressure. So correct answer is A, lay the patient supine and notify the physician. Question number 53. A patient presents with right shoulder pain and complains of difficulty reaching overhead with pain, especially from 60 to 120 degrees of shoulder flexion. Which special test would be most informative for this set of symptoms? Options are A, knee test, B, empty can test, C, crossover test and D, push off test. So correct answer is A, knee test. Question number 54. A patient has right leg pain and displays redness and swelling throughout the foot and ankle distal to the knee that has developed over last 3 days. A patient reports of no trauma and complains of a deep ache in the calf musculature. What is the most appropriate initial treatment? So options are A, refer to physician to further examination, B, elevate the lower extremity and apply an ice modality, C, instruct the patient on range of motion exercises and begin a home exercise program, and D, perform instrument assisted soft tissue mobilization to decrease swelling. So correct answer is refer to physician for further examination. Question number 55. While examining a patient's lumbar spine X-ray film, a physiotherapist notices that the L5 vertebra is displaced anteriorly on the sacrum by approx 50% of the vertebral body. How will this most affect physiotherapy if the patient is being treated for low back pain? Options are emphasize on core strengthening exercise with spine in neutral, B, begin progressive and gluteal strengthening to assist lumbopelvic fascia, C, avoid extension activities especially in standing, or D, add progressive external oblique training as tolerated to assist proper spinal alignment. So correct answer is A. Question number 56. A patient has just undergone a total hip replacement via posterior surgical approach. Which of the following combinations of movements of the hip are most important to avoid? So correct answer is flexion, medial rotation and adduction. Question number 57. A patient with cystic fibrosis is receiving postural drainage and percussion for the right lung's middle lobe. What is the most appropriate patient position? So options are supine on a wedge with left shoulder elevated on pillows with the head lower than the pelvis. B. Supine on a wedge with the right shoulder elevated on pillows with the head lower than the pelvis. C. Prone with the right shoulder elevated on pillows and the head on the same plane as the pelvis. And D. Prone with the left shoulder elevated on pillows and the head on the same plane as the pelvis. So middle lobe है, so दोनों का same plane तो नहीं होगा, ठीक है. And जो right लंग है उसका करना है परकशन. सो लेफ्ट साइड में लेटेंगे जो पेशेंट होंगे. सो करेक्ट आंसर इज ए. क्वेश्चन नंबर 58. The Phelan's test is designed to determine the presence of. Options are lateral epicondylitis, peripheral neuropathy, impingement syndrome, and the carpal tunnel syndrome. So Phelan's टेस्ट जो होता है वो कार्पल टनल सिंड्रोम के लिए यूज़ किया जाता है. सो करेक्ट आंसर इज डी. क्वेश्चन नंबर 59. मीडियम फ्रीक्वेंसी करंट्स आर दोज विद फ्रीक्वेंसी रेंजेस फ्रॉम. सो ऑप्शंस आर 1 Hz to 100 Hz, 1 Hz to 1 MHz, then 1 MHz to 3 MHz, then 4000 Hz to 5000 Hz. So correct answer is D, 4000 Hz to 5000 Hz. Cause of Bell's palsy is, options are idiopathic, vascular, traumatic and infection. So correct answer is A, idiopathic. Question number 61. Conventional tense is, options are high intensity low frequency stimuli, high intensity high frequency, low intensity low frequency, or low intensity high frequency. So conventional tense is a high tense and high indicates frequency. So high is the frequency and low is the intensity. Question number 62. Which of these is a characteristic source of energy of the ATP-PC system? Options are glycogen is the fuel source. B. Major source of energy during first 30 seconds of high intensity exercise. C. Major source of energy from 30th to 90th seconds of exercise. And D. Major source of energy after the second minute of exercise. So correct answer is, from my side, it's B. Question number 63. Which of the following is not due to activation of the pelvic floor musculature? Options are helps in generation of intra-abdominal pressure. B. Assists unloading of the spine. C. Has an excitatory effect on bladder activity. And D. Maintains the anorectal angle. So correct answer is C. Has an excitatory effect on bladder activity. Question number 64. Spirometry does not determine. The options are tidal volume, vital capacity, inspiratory reserve volume, and D. Residual volume. So correct answer is D. Residual volume. Question number 65. Truncal ataxia is seen in lesions of. Options are cerebellar vermis, neocerebellum, archicerebellum, or paleocerebellum. So correct answer is A. Cerebellar vermis. Question number 66. The cell membrane is least permeable to. Options are sodium, oxygen, water, or carbon dioxide. Correct answer is A, sodium. Question number 67. In a symphysis, two bones are connected by a broad flat disc made up of. Options are hyaline cartilage, B. Elastic cartilage, C. Fibrocartilage, D. Dense regular connective tissue. So correct answer is C. Fibrocartilage. Question number 68. When an individual is under stress, hormones are released. Which of the following is not one of the locations in which stress hormones are released? So the correct answer is parathyroid. Question number 69. Muscle not involved with scapular stabilization is. Options are trapezius, serratus anterior, supraspinatus, levator scapulae. Correct answer is C. Supraspinatus. Question number 70. Genu venom is positively correlated with. Options are larger lateral compartment load, B. Higher external knee adduction movement, C. Higher internal knee adduction movement, and D, higher external knee abduction movement. So correct answer is D, higher external knee abduction movement. Question number 71. Shoulder dislocation is caused by vigorous. Options are flexion with internal rotation, flexion with external rotation, abduction with internal rotation, and abduction with external rotation. So correct answer is abduction with external rotation. Question number 72. Massage technique commonly used at the beginning and conclusion of treatment is. Options are vibration, tapotement, effleurage, and D, petrissage. So correct answer is C, effleurage. Question number 73. While stump bandaging a transtibial amputee, the therapist should adhere to all except that the elastic wrap should. Options are B, smooth and wrinkle free, provide increased pressure proximally, B, applied using diagonal tones, and B, applied to encourage knee extension. So correct answer is B, provide increased pressure proximally, but it will not provide increased pressure proximally but distally. Then question number 74. Avascular necrosis of head of femur is not seen in. Options are subcapital fracture, intertrochanteric fracture, transcervical fracture, and D, central dislocation of hip. So correct answer is D, central dislocation of hip, because here is dislocation and not the compensation or cut of the vascular supply of the head of femur that is causing the avascular necrosis, and which is due to these conditions or these fractures. Question number 75. Initial treatment of myositis ossificans is. So options are manual therapy, active mobilization, then moist therapy, then immobilization. So correct answer is D, immobilization. 76. Close pack position of the radiocarpal joint is. A, full extension and radial deviation, B, full flexion and radial deviation, C, full extension and ulnar deviation, and D, full flexion and ulnar deviation. So correct answer is full flexion and radial deviation. 77. Soleus muscle has. Options are A, B. A has first fatigue motor units, B is a postural muscle, C is a two joint muscle, and D supports the medial longitudinal arch. So the correct answer is A, has fast fatiguing motor units. Question number 78. Expectoration of large amount of mucopurulent secretions and frequent secondary infections are the clinical findings of. Options are A, respiratory distress syndrome, B, cystic fibrosis, C, bronchiectasis, and D, chronic obstructive pulmonary disease. So correct answer is B, cystic fibrosis. Question number 79. A patient in phase 1 cardiac rehabilitation program begins walking with assistance. Options: which of the following monitoring techniques would not be necessary? Options are blood pressure, ECG, heart rate, and ankle brachial index. So correct answer is D, ankle brachial index. Question number 80. Which muscle is not a rotator cuff muscle? So options are supraspinatus, infraspinatus, teres minor, and pectoralis major. Pectoralis minor. So option D is the correct one, because pectoralis minor doesn't have any insertion on the humerus. Question number 81. Complication not common in Colles fracture is. Options are malunion, non-union, Sudix atrophy, and stiffness of the wrist. So correct answer is non-union, because rest of the options are common but not non-union, because it will definitely unite. Okay. Question number 82. Complication of fracture scaphoid is. Options are injury to radial nerve, AVN of distal part, AVN of proximal part, injury of radial artery. So correct answer is AVN of proximal part. Question number 83. Which of the below is not a phase of plyometrics? So Options are eccentric contraction, concentric contraction, static contraction, and D, amortization. So correct answer is C, static contraction. It is not a part of plyometrics. Question number 84, Charcot's joints are due to. So options are painless arthritic joint disease, degenerative joint disease, infective joint disease, and D, ankylosed joints. So correct answer is painless arthritic joint disease. Question number 85, pain sensation is carried by. Options are anterior spinothalamic tract, lateral spinothalamic tract, dorsal column, and D, spinocerebellar tract. So correct answer is B, lateral spinothalamic tract. Question number 86, stance phases. Options are A, 40% of gait cycle, B, 50% of gait cycle, C, 60% of gait cycle, and D, 70% of gait cycle. So correct answer is C, 60% of gait cycle. So question number 87 is serum uric acid level is high in. So options are SLE, ankylosing spondylitis, RA, and gout. So correct answer is D, gout. Question number 88. Due to damage of pyramidal system, a patient with cerebral palsy will demonstrate all except lack of muscle tone, dependence on primitive reflex pattern for ambulation, increased muscle tone, and loss of selective muscle control. So correct answer is A, lack of muscle tone. Question number 89, normal and feel can be. So options are bony, bogey, empty, spasm. So correct answer is A, bony. Question number 90, in close pack position the joint is. Options are least congruous, most congruous, conductive for performing joint mobilization, and D, in resting position. So correct answer is B, most congruous. Question number 91, the origin of transversus abdominis is. Options are A, pubic symphysis, B, linea alba, C, thoracolumbar fascia, and D, xiphoid process. So correct answer is C, thoracolumbar fascia. Question number 92, in pursed lip breathing, options are inspiration and expiration phases are equal. Inspiration is through pursed lip, expiratory phase is prolonged, D, and C is inspiratory phase is prolonged. So correct answer is D, expiratory phase is prolonged. Question number 93, the most common ligament injured in ankle sprain is. Options are deltoid ligament, posterior inferior tibiofibular ligament, C, posterior talofibular ligament, and D, anterior talofibular ligament. So ATFL is the commonest ligament injured in the ankle sprain. So correct answer is D, anterior talofibular ligament. Question number 94, tardy ulnar nerve palsy is seen in. So options are cubitus varus, dislocation of elbow, cubitus valgus, fractured head of radius. So correct answer is cubitus valgus. Question number 95, Bryant's triangle indicates. So options are supratrochanteric shortening, infratrochanteric shortening, anterior dislocation of hip, and D, posterior dislocation of hip. So correct answer is A, supratrochanteric shortening. Question number 96, earliest symptom of Volkmann's ischemic contracture is. Options are pain in flexor muscles, B, absence of pulse, C, pain on passive extension, and D, cyanosis of limbs. So correct answer is A, pain in flexor muscles. So question number 97, when the blood pressure rises, options are heart rate increases, vascular tone decreases, baroreceptor activity increases, or baroreceptor activity decreases. So correct answer is C, baroreceptors activity increases. Question number 98, D2 flexion pattern includes shoulder. So options are flexion adduction and internal rotation, flexion adduction, external rotation, flexion adduction, abduction, internal rotation, and flexion abduction, external rotation. So correct answer is flexion abduction and external rotation. Question number 99, a lady with traumatic brain injury has difficulty with rapid alternating movements during neurologic testing. The best term to describe this specific impairment is. Options are ataxia, dysmetria, dysarthria, dysrhydokinesia. So correct answer is D, dysrhydokinesia. Question number 100. A person with right hemiplegia complains of right shoulder pain. On examination, there is inferior subluxation of the right humeral head. Which of the following is the most appropriate treatment? So options are transcutaneous electrical stimulation, B. functional electrical stimulation, C. shortwave diathermy, and D. interferential current therapy. So correct answer must be B. functional electrical stimulation. So if you have any doubt in any question or answer, so you can comment in the comment section, and also do watch the comments and just calculate your scores and tell me in the comment section what score you are getting. And thank you so much for watching my video. Till then, take care, bye bye. And also tell me if whether you want a video on the concept of each and every single question. So yeah, do tell me in the comment section. Till then, take care, bye bye. And also don't forget to subscribe my channel.